A comprehensive strategic plan by mid-2025 will guide the turnaround of St. Lucia's troubled Millennium Heights Medical Complex, according to its newly appointed CEO Damian Greaves. A former health minister is promising a comprehensive review of operations at the home of the OKEU hospital, which has faced persistent complaints about service delivery and resource shortages.
I've been meeting heads of department, I've been meeting staff, I've been walking around. Today was a good day where I went into to look at the laboratory services and all of the equipment and get an understanding of what is going on. So I'm onboarding and basically getting to understand what is going on. And then I want to apply some diagnostics to really see where we are going. Look at, for example, our manpower audit, a clinical audit.
The medical complex, OKEUH, has struggled with long wait times and equipment issues. Greaves acknowledges these challenges while outlining plans to address them. However, he explains that his immediate focus is on conducting thorough assessments before implementing changes.
Yes, there are issues with supply chain. Yes, there are issues in terms of human resources. Yes, there are issues with equipment and the like. So all of those issues are there, but we are steadily moving through and trying to see what kind of corrective measures we can put in place by also speaking to our stakeholders, speaking to the providers, speaking to suppliers. All of these things are should be happening, because from my understanding, in terms of the supply chain, we also have to look at some of the challenges faced by our providers and suppliers overseas. So all of that I'm taking into account now with and I'm hoping that by next year, 2025, we start with a bang to put into position some of the corrective measures that we need to look at, including having a strategic plan by at least the first half of 2025. That is going to be critical in terms of our objectives, in terms of our outcomes, in terms of our goals, and where we want to see ourselves going between 2025 and 2030.
The facility currently faces a significant bed shortage. Greaves says this is part of a larger national healthcare capacity issue.
The Prime Minister has made a pronouncement that we are looking at the fifth finger, that fifth building that is going to bring some relief. We're also looking at our secondary care facility located at Victoria Hospital, where we can get some bed space, because right now, nationally, for all facilities, including the private sector, we have maybe a 135 bed deficit, but that is something that we can look into. But for our part at MHMC, we are looking at some of those. We are looking at those issues, and as I said, the supply chain. We are understanding that there are some forecasting issues, so we're looking at that, and we're moving steadily along in terms of the bed business, because we understand the shortage of beds as well. So all of those things are being done in tandem.
Operations at the Millennium Heights Medical Complex have been fraught with challenges since the OKEU hospital opened at the height of the COVID-19 pandemic in 2020 without an overarching transition plan. Its forerunner, the centuries-old Victoria Hospital, designated a polyclinic complex in 2024, was then converted into a respiratory center in 2020. Since then, the debt-laden Millennium Heights Medical Complex has struggled in the post-pandemic era of increased emergencies and a morbidity-hobbled St. Lucia population stricken with chronic diseases. Joachim Du Plessis, HTS News Force.